in the another video of the frontal bone. It is also one of the flat bone, and all the flat bones are made up of the compact bone, and in between them the spongy bone is present. Now, characteristics of the compact bone I already described in the another video of the temporal bone. This flat bone of the frontal bone, this frontal bone is 1 in number, means unpaired, while the paired bones are parietal bone, temporal bone, while unpaired bones are frontal bone, occipital bone, ethmoid bone, and sphenoid bone. The parts of the frontal bone: this is the squamous part, two orbital part, this is the orbital part, this is the orbital part, and this one is the squamous part of the frontal bone. You can see that. And this is the other nasal part of the frontal bone. So nasal part of the frontal bone, orbital part of the frontal bone, and this is the squamous part of the frontal bone. And this another one is between them is the beside, you can't see this because it is in the posterior side, so this part is also called the ethmoidal part of the frontal bone. Now this frontal bone have this is the margin of the orbital margin, or you can also say that as the supraorbital margin. Both side supraorbital margin is present, and here is the supraorbital notch. Here it is supraorbital notch. Now the orbital part of this frontal bone is mainly from the roof of the orbit, and here two fossa is present. In the anterior lateral side, this is the anterior lateral side of the frontal bone. This is also the anterior lateral side of the frontal bone is present. Here lacrimal fossa is present, and in lacrimal fossa lacrimal gland is present, and the function of the lacrimal gland, that is secretory function and serous in nature. So it secretes the serous watery fluid, that is called the lacrimal fluid, secreted by the lacrimal gland present in the lacrimal fossa. Here this is the anterior medial side of the orbital part of the frontal bone. Here it is also the anterior medial side of the frontal bone. This part is called as the trochlear fossa. This part is called as the trochlear fossa, and here the trochlear nerve. You all know the trochlear nerve, the fourth cranial nerve, that is also supplied to the eyes muscles of the eye. Now briefly explaining about the eye muscles, there are 6 eye muscles, and in these 6 eye muscles, 4 eye muscles are supplied by the third cranial nerve, oculomotor, and the other 2 muscles are supplied by the trochlear nerve, one by the trochlear nerve and one by the abducens nerve. The all 6 muscles are named as the lateral rectus, medial rectus, inferior rectus, and superior rectus. These 4 rectus muscles and 2 muscles that are superior oblique muscle and inferior oblique muscle. Now the trochlear nerve is innervated the muscle that is called as the superior oblique muscle. Here the superior oblique muscle, and here the innervation trochlear nerve is coming out from the superior orbital foramen. Superior orbital foramen is present here in the trochlear fossa, and superior orbital foramen is responsible for other cranial nerves also exit from the superior orbital foramen. Oculomotor nerve is supplied to the inferior oblique muscle, and all other muscles except the superior oblique muscle and the lateral rectus muscle of the supplied by the abducens nerve, that is the 6th cranial nerve. So 3 cranial nerves supplied to the eyes muscles. These cranial nerves are oculomotor, that is 3rd cranial nerve, and the 4th one is trochlear nerve, and 6th one is the abducens nerve. And in the 4th and 6th cranial nerve, trochlear nerve is supplied to the superior oblique nerve, superior oblique muscle, and the abducens nerve supplied to the lateral rectus muscle. Now briefly I describe about this lacrimal fossa and trochlear fossa, and this is the superior orbital foramen. Here it is the portion of the frontal bone that is called as the glavula. Now coming on the articulations of the frontal bone. Frontal bone is articulated to both of the parietal bone by this suture. This is called as the coronal suture. And here if you dissected any body, then this part is called the coronal section. Coronal section of the dissection. Coronal section of the dissection divided the body into two parts, named as the anterior part and as the posterior part. Here the other processes of these bones join together and forming the arch, that is the frontal. This is the zygomatic bone, and here it is the zygomatic process of the frontal bone, and it is the frontal process of the zygomatic bone. Both are joined together and forming the frontal arch or the zygomatic arch. Here it is the frontal process, here the zygomatic process of the frontal bone. Now this is present in the both sides, and most of the orbit part is formed by this frontal bone. Now coming on the nasal part of the frontal bone. Here nasal part of the frontal bone is articulated to this two nasal bones, and also it is articulated to the maxillary process of the frontal bone and frontal process of the maxillary bone. Here it is the frontal process of the maxillary bone, both side, and between them two, this is the two nasal bones. These are articulated to the nasal part of the frontal bone. Just behind the glavula, you can hear the frontal sinuses are present in the both side. Left and right side frontal sinuses are present. They are paired sinuses. So this bone can also be called as the pneumatic bone, because here the frontal sinuses are present, and these frontal sinuses are air filled. What are the four sinuses that have the air? These are frontal sinus, sphenoid sinus you can't see in this picture, but you can see in different diagram. Here sphenoid sinus is present, frontal sinus is present in the frontal bone behind that, and the maxillary sinus. Now you can see the also the articulation of the frontal bone to the zygomatic bone. Here the sphenoid bone. Here it is the sphenoid bone. Here is the zygomatic bone. This sphenoid bone, greater wing of the sphenoid bone, joined to the frontal bone, and also the ethmoid bone is joining to the frontal bone in the different views. And this ethmoid bone, the crista galli or called the cribriform plate, that separated the two orbital part in near the anterior inferiorly. Here in this diagram you can see clearly the sinuses that are air filled sinuses. This is the frontal sinus. Here this is the frontal sinus, and here this one is the sphenoidal sinus, sphenoid sinus. This is the maxillary sinus, the bigger one, the biggest ear sinus, that is maxillary ear sinus. And another one is the palatine. You can see the palatine ear sinus here, just behind that. This is the palatine ear sinus, and frontal ear sinus are paired in number. Now coming on the ossification of the frontal bone, as these all flat bones have the ossification by their primary and secondary ossification center. Here the frontal bone have the two prominence. Frontal bone have the two prominence from where the primary ossification center is present, and this ossification of the bone is started from the second year and completed till to the 8th year of the child. During the time of the birth, these frontal bone are two in number. They are separated, they are not joined together, and they are not aligned together. So they are two in number in the child, and the suture present between these two frontal bone in the child is called the meiotopic suture. So this suture separate the two frontal bone. In the child, two frontal bone is present, while in the adult, after the 8 years of the age, these bones get ossified and get fused together and form a single bone, a single and unpaired bone, that is the flat bone and the frontal bone. This form the forehead part of the skull. Now in this view you can see the different articulation of the frontal bone. Here this one, this is the ethmoid bone. Ethmoid bone is joined to the frontal bone, and here it is the lesser wing of the sphenoid bone, is also joined to the frontal bone. Here the optic canal is present. Optic canal and or called as the optic foramen. It is the opening from where the eighth cranial nerve is coming out, and this opening is formed between the lesser wing of the sphenoid bone and the ethmoid bone. Here this is also called as the, this bone, this cavity is called the superior orbital fissure. Two orbital fissures are present. One is the superior orbital fissure, and that this one is the deep inside and downward. This is called the inferior orbital fissure. Now coming on the innervation, this frontal bone is supplied by the fifth cranial nerve, the branch of the fifth cranial nerve, that is called the ophthalmic nerve. Here this is the orbital part, this whole orbital part and up to the glabella, this part is supplied by the fifth cranial nerve, that is called the trigeminal nerve, and the branch of the trigeminal nerve is the ophthalmic nerve. You all know about the trigeminal nerve. It is the largest cranial nerve which have the three branches: ophthalmic branch of the trigeminal nerve, maxillary branch of the trigeminal nerve, and the mandibular branch of the trigeminal nerve. This is supplied to the facial part. Now in summary, we learned about the frontal bone. Frontal bone have the or two orbital part, one squamous part and the nasal part, and the ossification started from the second year of the child, after the delivery of the child, and up it get completely ossified up to the 8 years of the age. And in the child these frontal bone not joined together, and in the child two frontal bones are present, and these between these two frontal bone the meiotopic suture is present, and here the fontanelle is formed in the child, while in the male or the in the adult they both get fused together and form a single bone, that is called the frontal bone. This is the kind of the flat bone. Thanks for watching this video.